This is the Rapid Sequence Intubation Module, often called RSI. It is a method of choice for tracheal intubation to establish an airway. Pharmacologic agents are often used to facilitate intubation as well as decrease potential adverse effects. RSI may be needed for functional or anatomic airway obstruction, loss of protective airway reflexes, excessive work of breathing, or inadequate CNS control of ventilation. It may be also needed to allow sedation for diagnostic studies to ensure airway protection and ventilation, or the potential of any of these occurrences if planning to transport the patient. Pharmacy will be a part of RSI in the steps involving medications. Some of the medications used in RSI include pre-medication agents, sedating agents, and paralytic agents. Let's start with the pre-medication agents. The anticholinergic agents atropine and glycopyrrolate can be used to minimize bradycardia and asystole. They can also be given to decrease oral secretions to allow for increased visualization for placing the tracheal tube. Indications for the use of anticholinergics include infants less than 1 year old and children 1 to 5 years old who are receiving succinylcholine and are experiencing bradycardia at the time of intubation. Lidocaine is another pre-medication agent and can be used to reduce the increase of intracranial pressure, or ICP. Lidocaine is also indicated in patients with head trauma and increased ICP. Lidocaine should be dosed 1 to 2 milligrams per kilogram per dose, undiluted, given over 2 to 5 minutes. 2% is the most common strength used of lidocaine. Analgesia agents are used to decrease or prevent pain. These agents are often given shortly after intubation, but may also be given beforehand to help with sedation. Fentanyl is given when hypotension is present in the patient. To give a dose of fentanyl, use 1 to 4 micrograms per kilogram per dose IV, undiluted, over 2 to 3 minutes. Morphine is another agent to use, but it has the potential to cause hypotension in the patient. To give a dose of morphine, use 0.05 to 0.1 milligrams per kilogram per dose, IV, undiluted, over 2 to 3 minutes. Now let's discuss sedating agents. Benzodiazepines are often used. Midazolam should be administered IV, undiluted, over 2 to 5 minutes. Lorazepam should be administered IV, diluted, with normal saline, then given over 2 to 5 minutes. Ketamine can provide analgesia during rapid sedation without decreasing respiratory function. This is the preferred agents for asthmatic patients. It should not be given to head trauma or stroke patients because it can cause increased ICP, and it should not be given to neonates due to neuronal apoptosis. Ketamine may require the use of pre-medication agents like atropine or glycopyrrolate to prevent excess airway secretions. It can also be used with a benzodiazepine to combat hallucinations. Ketamine should be administered 10 milligrams per ml concentration IV push. The maximum concentration is 50 milligrams per ml, and it can be diluted with normal saline or D5W. It can also be administered IM. Etomidate can provide sedation, but it does not have analgesic properties. It has minimal depression of the lungs and the heart. Patients with a history of focal seizures should not receive etomidate. Etomidate may require pretreatment medications with a benzodiazepine or fentanyl to decrease involuntary muscle movements. Etomidate should be administered IV, undiluted, over 30 to 60 seconds. Duration is short-lasting, only 4 to 10 minutes. Finally, let's discuss paralytic agents. Rocuronium is safe for the use in patients with renal failure and patients with mild to moderate hepatic failure. It has minimal effects on the cardiovascular system. Rocuronium should be administered 1 milligram per kilogram per dose given IV as an undiluted push. The duration of rocuronium is between 30 and 60 minutes. Vecuronium is safe for the use in patients with renal failure, but duration can be increased in patients with hepatic failure. Vecuronium also has minimal effects on the cardiovascular system. To administer vecuronium, mix a 10 milligram vial with 10 mL of sterile water for injection for a 1 milligram per ml solution. Dosing is 0.1 milligrams per kilogram per dose given IV push. The duration of vecuronium is between 30 to 90 minutes. Succinylcholine should be avoided in patients with renal failure, burns, or hyperkalemic states. Administering succinylcholine is based on age. Infants should be dosed at 1 milligram to 2 milligrams per kilogram per dose, given undiluted IV push. Children should be dosed 1 to 1.5 milligrams per kilogram per dose, given undiluted IV push. Duration of action is only 3 to 5 minutes. Onset is only 30 to 60 seconds. Children ages 1 to 5 receiving succinylcholine should be pre-medicated with atropine 0.02 milligrams per kilogram per dose given IV. This concludes the rapid sequence intubation module. You may review it again at any time.